Welcome back. I'm Michelangelo Signorile on Sirius XM Progress 127. We've talked a lot on the program about Truvada, otherwise known as PrEP, which stands for pre-exposure prophylaxis, the drug that really, in an extraordinary way, is effective at preventing HIV. It's a two-drug combination, a pill a day. In studies has been shown to be over 90% effective. Some people say over 96% effective.
There's a lot of ways
it's very, very effective.
Yes.
And
one way that Bob Grant from UCSF, University
who did
of
the
California,
original study
San
on it.
Francisco, has done two major studies among men who have sex with men, which is the public health all-encompassing term for men who have sex with men, or gay and bisexual men, you might want to say. But the way he puts it is PrEP works if you take it.
That's right.
Right.
And Ben Ryan is the
Hello.
voice you hear, who is a writer who covers healthcare and HIV and certainly PrEP and HIV prevention for Pause magazine, and also has a website with all of his writing, which you should go to, and a lot of research there on PrEP as well, benryan.net, which is really, really easy.
Right.
We've talked a lot about Truvada and its effect and the controversy around it on the show. We've had many people on talking about the controversy around it. That seems to have died down much more. What really hasn't changed probably is a greater awareness of it. Doctors and, many people in healthcare still are not as educated about it as they should be. And even across the country, many gay men, obviously a group that is greatly affected by HIV, not aware of this drug and the availability of it. Some of the criticism in the past, and still coming from one particular group, the AIDS Healthcare Foundation, claiming that it will inhibit people from using condoms. And they're worried also about uptake. Can people take a pill a day? Studies in the past have shown both things not to have happened. And this latest study we're going to talk about, not really a study, but really a tracking of 600 men.
It's not a study in the sense that there's not a classic control group. So
Right.
that makes it difficult.
It is being characterized as a study.
They have, but I refer to it as the paper, for example. But they're studying these people, but they don't have a control group
It's
against
the
which to
insurer Kaiser Permanente.
They're both an insurer and a provider of healthcare. There's a massive system in California.
And they studied for 2.5 years, 600 men in San Francisco, which is a pretty big group and pretty, I guess, pretty definitive in the sense that a lot of the other studies were not necessarily on gay men in the United States, right?
Right. Well, one of the big things about this study is that, call it a study, but it's a real world situation. So this isn't something that's been fabricated where people are in a clinical trial and they're being recruited in that sense. These are people who came in to the clinic in San Francisco and they wanted to be on PrEP, and they had a consultation and they either did or did not decide to go on PrEP ultimately. And one thing that's consistent with a lot of the studies that we've seen in the real world is that those people who were at greater risk of HIV were more inclined to take PrEP. So that's very encouraging to know.
Right. So these were people who came in to use it, people who needed it, felt they needed it. And that's been a lot of discussion, too. Who needs it? Who should be on it? Obviously, a lot of people who found that they had a trouble using condoms found themselves not using condoms. This has been targeted to them, and they came in looking for PrEP, and that's who was studied by this particular group.
Right, and when you think of people who are already in sexual behavior patterns in which they're not using condoms for whatever reason, there's a big concept in public health which is known as harm reduction, which essentially says we meet people where they are, we don't judge their behaviors, but we try to find ways to, give them something that they can take or model the behavior in some way to lower their risk of contracting a disease or having some other negative
Right.
outcome. And that's what Truvada really is.
Right. And I always tell people, if it's something you're interested in, you should talk to your doctor and think about it. And it's one pill a day. And it, as we just said, is enormously effective.
Right.
Now,
and it's also covered by insurance, and you can, most people can get their copays covered by Gilead, the company that makes the drug as well.
Right. And there have been some controversies, some insurance companies that dropped it, but then they
there's
changed.
I can't remember who it was, but there was one that was going to, and of course there was an immediate firestorm, and they backtracked immediately.
And also Medicaid covers it.
Medicaid
as well.
covers it.
Yeah.
Indeed.
So what they found here, not one infection among the 657
men who have sex with men, and there were 3 heterosexual cisgender women and 1 transsexual man who has sex with men. So essentially, it's almost entirely men who have sex with men.
Right. So that would actually show us 100% effective in a sense.
Well, you can't really say that. We can speculate, yes, because, again, we don't have the control group. One thing we can do is we can try to compare.
And the control group would be the group of people who weren't using it, who they were comparing to.
Correct. And so we can try to compare the general behavior patterns as indicated by the rate of acquisition of sexually transmitted infections in the group. We can try to compare that rate to ones in other studies that have had control groups. So a very notable fact is that within the first year or partial first year of those taking PrEP in this group in San Francisco, half of them contracted at least one sexually transmitted infection. And that's a very, very high rate of acquisition.
Right, and that was something that some people saw as concerning about the information in this study. Two things. One was that, and again, other studies have shown, and this has been the criticism of PrEP, and other studies have shown it's not true, that PrEP would inhibit condom use, that people would start would basically stop using or
condoms, use them at a lower rate.
And what we found here was that a certain percentage of people, substantial percentage, did say they after they began taking PrEP weren't using condoms as much.
Right. 41% after a 6-month period reported using less condoms after they started PrEP. And this goes against the findings of pretty much every single study that we've seen about PrEP amongst men who have sex with men. None of them found that men are using condoms less or engaging in other forms of what's known as risk compensation, which would include having more sexual partners, for example. And one of my theories about why we haven't seen that in other studies is that in order to get into one of these studies, you have to be high risk to begin with. So let's say you're at a risk of a level 10, and there is no 11. There's really nowhere higher that you can go. But if you come into using PrEP at a 3, there's much more latitude. So I think
you're talking about in the other studies.
Right. In all the other studies, you had to be high risk to come in. Whereas in this study, you just had to be interested in PrEP. Granted, most of them were high risk, but there might be a wider spectrum in terms of where they started the study.
So when you say high risk, they were already people who largely were not using condoms, so the study wouldn't
that
show...
would have been a requirement to participate in the major PrEP studies.
So the study wouldn't show a decrease in condom use because they already were not using condoms.
It could. I mean, it depends on how often they weren't using them. They could have just not used them once in the past year or something like that.
But we should point out again, there's no control group here to say, well, did 600 other men who were not on PrEP also stop using condoms at the same percentage?
Let's create somewhat of an imaginary comparison group. And this is a bit clunky. There's a big caveat here. But there was a study that was released from the UK, the United Kingdom, earlier this year called the PROUD study. And in that study, it did have a comparison group. They took about 500 men were divided into 2 groups. One received PrEP immediately, and another group was set to receive it after a year delay. And they did find that in that study that PrEP was highly successful, that it led to an 86% reduction in risk. And sexually transmitted infection acquisition rate in these two groups were very similar to what we saw in the San Francisco group. So about 57% after a year in the UK group got a sexually transmitted infection compared to about half in San Francisco. So that's a good indicator, and it's something that doesn't rely on self-report. You can test for that. And self-report is notoriously unreliable. But testing for a sexually transmitted infection is reliable because you've got medical proof, right? So we can conjecture that they were engaging in similar levels of risk. However, it is different in the UK that people in the UK, men who have sex with men, are probably more inclined to encounter having sex with somebody who is HIV positive who has untreated HIV. And that's a big difference because if you are treated for HIV and you have an undetectable viral load, a fully suppressed viral load, it's very unlikely that you'll transmit the virus. So San Francisco has done a very good job of treating HIV, testing and treating HIV. So the people in San Francisco are probably less likely to actually encounter transmissible HIV than the people in the UK. So there is that difference. But in the UK study, 9%, they were getting HIV if they weren't on PrEP at a rate of 9% per year. And if you multiply that by the fact that all told, there were 388 what's called person years in the San Francisco study, and that means that that's all the time put together of all the studies. You multiply that by 9% of the UK study, you would say that, okay, similarly, you would probably have about 35 infections in San Francisco. It's probably less than that since they're less likely to get HIV in general. But I just spoke with one of the researchers from Kaiser who researched all this stuff going on in San Francisco in this group, and he said that certainly there would be at least some HIV infections were they not on PrEP and engaging in the same types of sexual behaviors.
Right. But we did see that people tended to want to take more risk, at least what they said.
Right. They reported that.
And then they also reported higher sexually transmitted infections. Are we talking about syphilis, gonorrhea,
right,
chlamydia?
Gonorrhea, syphilis. Gonorrhea and chlamydia are the biggest one, and then syphilis is smaller. And that's a cause for concern because the more people get gonorrhea, the more that it's treated, the more likely we are to see the development of drug-resistant gonorrhea. And we're kind of on our last drug in terms of how well we have, what kind of a firepower we have against gonorrhea in this country. They're always researching new drugs, but that's a cause for concern. On the other hand, because a requirement of taking PrEP is regular HIV and STD testing, these people who maybe would have gotten this level of STIs, sexually transmitted infection anyway, it's great to know that they're integrated in healthcare and that they're going to be treated.
And what people should know is that when people are on PrEP, they have to get tested every 3 months. So you have to go in and get tested every 3 months for all sexually transmitted diseases.
The CDC recommends twice yearly STI infection testing and then quarterly HIV testing. But a lot of people will get STI tests.
A lot of doctors
quarterly
are saying, you have to get it.
If I were a physician, I absolutely would recommend quarterly STI testing.
Right. So that means that you have more people getting tested and then treated, and so that is a good thing.
Right. But you never know when they're out having sex in the wild, per se, if they might be transmitting STIs to people who aren't integrated in healthcare, and that's a cause for concern.
Right. That's right. And then your point about drug-resistant gonorrhea, and we've seen drug-resistant syphilis in the past years as well.
Yeah. So, and syphilis, which was largely disappearing from this country in years past, and has undergone a serious resurgence, mostly because of men who have sex with men. So that's a cause of great concern, and it's very disappointing to the public health community at large.
I mean, it's important to bring awareness to PrEP in terms of battling HIV, and it's one, we talk about it, HIV prevention, people talk about it as one tool in the toolkit, right?
That's the verbiage.
That's the
People
term.
are really fond of that. It's getting a little canned at this point, but it's very true.
But that still condoms are important for
Absolutely.
And still education, period. But so it is important for people to know about it. But in this larger debate that has happened, or there are certainly those who are opposed to PrEP. Would you say that this particular study kind of gives both sides something here?
Well, AIDS Healthcare Foundation and its president, Michael Weinstein, who's sort of the bête noire of PrEP, his position keeps evolving as there's less and less research to back up his fairly anti-PrEP stance, although he'll deny that he is anti-PrEP. But this basically his latest position has been that PrEP should be an individual decision, should not be used as a wide-scale public health intervention, and this does sort of dampen the mood on his perspective, because it really does show a great number of people in a very high-risk area who are engaging in high-risk behaviors are able to take PrEP. Very likely they're taking it very well.
It kills the idea that they can't adhere. They can adhere enough not to be infected.
If you parse apart the data in what's called the study called IPREX, its open label extension phase, which was published last summer, it was a worldwide study, but if you look, and in general, the men who were in that study adhered very poorly. But if you look just at the Americans in that study, they adhered quite well. So it is not surprised to me that American gay and bisexual men will adhere well to this medication, especially the early adopters of it who are very enthusiastic. And they, in many cases, have to jump through a lot of hoops. They have to see doctors who don't want to give it to them and so on, deal with various insurance hurdles. These people are motivated. But the real question on a larger public health scale is, okay, we've got these early adopters, these highly motivated people. What about the rest of the people? What about the real core of HIV risk in this country, which is young, gay, Black men who have sex with men? Will they take it?
Well, and not just will they take it, can they get it? I mean, that's been my issue from the beginning, is how do we get it to the people who most need it?
Right.
And that's where we need government.
Right. Young, gay, Black men who have sex with men tend to be disenfranchised from healthcare, and there's a long history of mistrust of the healthcare system among African Americans in general, which largely dates back to the Tuskegee experiment in large part. So that's a huge problem. It's great that we're seeing the expansion of healthcare through Obamacare, the Affordable Care Act, especially the expansion of Medicaid. However, not all states have done so, and that's a huge problem largely in the red states in the South. So.
But I did see Larry Kramer debating with Peter Staley, of course, both prominent AIDS activists, on Facebook, and Larry was pointing to the STI infections, and Peter was sort of downplaying that as well. I think that's going to be an issue that activists will debate.
Personally, from all the anecdotal experience that I've seen, just people talking online, people I've met, people I've interviewed, is, in my opinion, yes, in general, a lot of gay guys going on PrEP are going to start using condoms less. I think that's a very real thing that we need to acknowledge. And it's a big shift, especially in major urban areas like here in New York City or in San Francisco, that's changing. And that may, yes, indeed.
And how will that affect others who aren't on PrEP and don't have a problem using condoms, but now the other guys are like, well, I don't use condoms.
Right. And it's, it's causing something, a divide, where there are people who refuse to use condoms no matter what, and others are not comfortable with that. So in a sense, the pools are shrinking and dividing about who's going to be with who. And there's some frustration that I've certainly seen with gay guys out there.
Well, it's real important. So glad to have you on the show to talk about it. And I hope you'll come back again to talk about this and other issues. You do a lot of great reporting for PAWS, and people should go to benryan.net to get more info on PrEP and lots of other stuff.
If you go to benryan.net/PrEP, you'll get all my reporting on that. Lots of
on that, and read PAWS.com.
That's right.
And they could see all of your work there. Thanks so much for coming.
Thank you very much.
Ben Ryan. We're back in a few minutes.
The Michelangelo Signorile Show.